And now back to Roger Cooper and the American Health Journal.
When a heart aortic valve is damaged or worn out, a replacement surgery is often performed. A new procedure called Transcatheter Aortic Valve Implantation is being investigated. Dr. Brian Hummel of Lee Memorial Health System discusses the potential benefits of this new procedure.
The valve has been in Europe for several years now, and it shows great promise primarily for patients that would not otherwise tolerate traditional surgical approaches. And by that I mean a full run on the heart-lung machine where their heart is stopped, their old valve is removed, and a new valve is inserted. Some of those can be done minimally invasively through small incisions, either upper breastbone or from the side of the chest, but it still requires the utilization of the heart-lung machine. The promise and the benefit of this procedure is that there's no heart-lung machine, and in some instances can be performed under local anesthesia with very mild sedation, and the patient's got a new valve. Most of the patients that receive the aortic valve replacements, the majority are an older population, what we call senile sclerosis, if you will, of the aortic valve. It's a degenerative process that occurs over time and is part of the aging process. There are other congenital, obviously, issues that can create a bad valve, bicuspid valves. Those can be replaced in a much younger patient. But the patient population that this is focused for is the older patient. And one of the interesting things that has come out of the study in trying to identify patients that would most benefit is a frailty index, if you will, and really trying to assess the patient's day-to-day activity levels and really focus on those patients that just don't tolerate major surgical procedures otherwise.
How successful have the results been so far?
Well, actually, it's been surprisingly successful. We've been pleased by the outcomes that have been reported in the large trial, the partner trial. And one of the major drawbacks in any time that you manipulate the aorta or these valves is potential for strokes. In the experience centers, the more and more that we're seeing that the stroke rate is coming down. But it is still a concern to everybody. Part of it will be the new delivery systems that have been devised and now again are available in Europe. They're not going to be available in the States for some time, but those also offer promise for reducing the stroke rate. Years from now, if the valve proves durable, and we really don't know how long these valves are going to last inserted this way, but if they prove very durable, I anticipate that younger patients will have them made available to them. One of the operations that is done frequently in this country now is replacement of old prosthetic valves that have been inserted. In certain instances, if a patient has had a prior tissue valve, this may be an alternative to redoing that, is simply insert a new valve directly into the old valve. And again, that's being done in Europe. That's not going to be the norm here for at least some time, but that is another alternative use and potential benefit for those patients that have had old prosthetic valves.
For more information about Dr. Hummel or Lee Memorial Health System's cardiac program, call 239-454-8725 or visit leememorial.org.